Hi there. I'm Jo, the nurse specialist at the Marfan Trust, and as part of a Marfan Awareness Month, we thought it would be a really good idea to speak to some of the healthcare professionals who are involved in providing care and support to all of our members. And so today I am joined by Fortunate and Rachana. They're both nurse specialists at the Brompton Hospital. There are nurse specialists across the country within aortopathy teams and other nurse specialist teams, and they're a really valuable resource for you. And I think sometimes people aren't aware that they're around within these clinics. So we thought it was really useful to highlight their role and how they can help you on your Marfan journey. So thank you, Fortunate and Rachana, for joining us. If you don't mind, would you just quickly introduce yourselves and let us know what you do?
Thank you for inviting us. It's a pleasure to be in this platform. So my name is Fortunate and I work at the Royal Brompton Hospital. I have actually almost 20 years of experience working as a nurse. And my experience ranges from all aspects of nursing, including cardiac, respiratory, surgical nursing, and high dependence nursing. So my current role is clinical nurse specialist within inherited cardiac condition, and I look after patients affected with aortopathy syndromes. And I started this role almost about 8 years ago. And I've been in this role working alongside clinicians and cardiac specialists within this role. So very excited to be here.
Brilliant, thank you.
Thank you very much, Jo, for the invite. I'm also very thrilled to be here. Thank you for including us. So myself, I'm Rachana Ramakrishnan. I am working currently as a pediatric aortopathy clinical nurse specialist in the Royal Brompton and Harefield hospitals. My background in nursing is starting with the neonatal nursing in neonatal intensive care. And then I've also worked in pediatric intensive care unit and in cardiology, cardiac pediatric intensive care at the Royal Brompton Hospital. And then I've joined ICC team at the Royal Brompton for the last 3 years, and I've been with the ICC team.
Brilliant.
Thank you.
So lots of experience between the two of you. It's reassuring for people, I think, to hear that. So tell us, what does the day in the life of an aortopathy nurse specialist look like? What are you doing on a day-to-day basis in the clinics and with patients?
Well, so we predominantly work virtually, and we also have work sometimes online on site if we're doing clinics and seeing patients on the ward and supporting families on a face-to-face basis. But we start off our day with working, maybe reviewing emails, looking at emails. We have joint emails that we look at patients' queries. We can answer those queries, address patients' queries, can start from asking about maybe appointments, maybe their individual care, or they can be querying about what tests that are lined up for them. We also work closely with consultants, and we can be conducting nurse-led clinics within a consultant-led clinics. We can be supporting those clinics. We can also be doing things like symptom management, which will include like disease monitoring disease status through imaging or reviewing symptoms, responding to patients' queries. In addition to that, we do attend MDTs, which are multidisciplinary meetings that can involve cardiologists, geneticists, and the general ICC teams, the nurses, and all other aspects of care. And there we discuss complex patients, we discuss how to manage these patients, we discuss maybe genetic testing for other family members and how we can assist with this. A lot of the times also we do a lot of outreach work and outreach teaching, and therefore we're raising awareness of what we do. We're raising awareness of genetic conditions, and they may involve doing teaching sessions on the ward with other nurses, or teaching on bigger platforms and joining other awareness groups to spread awareness of these conditions. We do a lot of referrals and triaging of referrals as well. That's is a bigger part of our jobs. And that way we'll be doing a lot of coordinating of appointments among our, teams in addition to that. So yeah, our day can be quite packed with all sorts of aspects of things that we need to do, but we are the link between geneticists, cardiologists, and various members of the team. So
it sounds like you can streamline things for patients because you're able to coordinate those things between all the different specialities.
That's right.
Okay,
brilliant. Rachana, what about you? You're working with pediatric patients.
Yes, so all the aspects that Fortunate discussed just now, and also with regards to pediatric patients, we are also closely work with families involving that involves devising school care plan for children and also talking to them, giving them counseling, especially with our teenagers who are transitioning from pediatric services to adult service. We have consultation with them to assess their awareness of the condition, how ready they are in order to be transitioned to the adult services. And also it involves a lot of counseling and discussion with the family members, addressing their questions and concerns and supporting them via phone, email, and also giving children support at school in other ways. For example, those children with Marfan syndrome who have chronic pain and they struggle to climb up a lot of stairs at school, whether it is to give them a lift, asking permission to give them lift pass at school, or whether it is to give additional time for examinations. These are the aspects that the nurse specialists can help with when it comes to pediatrics.
Okay, fantastic. That sounds really helpful. I think a lot of families would appreciate that extra support. Just a quick question, because it's Marfan Awareness Month and our strap line is for this month is see the signs, save a life. So we're trying to get more awareness going. Did you learn about Marfan syndrome and genetic conditions during your nurse training, or have you learned further down the line? I know from my point of view, I trained in the late 90s and I didn't learn about genetic conditions because they were in their infancy, but I was interested. You probably trained a bit after me, so I was interested to know if that had changed or not.
For me, I remember that we did learn about core genetic patterns of inheritance and the genes and genetic disorders in general, but I don't recall learning specifically about Marfan syndrome or other connective disorders in detail. But I think that this is really important. But a lot of things have changed now, even from the time that I graduated. Yeah. I know that genomic is now included in NMC standards of proficiency for nurses. So I think this is really important.
Okay.
Yeah, I'm not very far off with you, Joanne. I turned a long time ago. And again, what Rachana has touched on is really that learning inheritance at the core skills, not necessarily specific to diseases.
Yeah. And I think that learning comes as you take on these more experienced jobs and you get more experience seeing patients, isn't it? You start noticing those features and things. Okay. So do you see, what I wanted to find out from your point of view is, do you see a lot of people who are waiting for a diagnosis, or are most of the people that you see already diagnosed? And how does it differ, the two different sort of the groups that you see?
I think that a lot of people are getting a quicker diagnosis these days with the advancements in genomic knowledge and the genetic testing of genetic testing across the NHS is much more now compared to before. So a lot of people are getting a quicker diagnosis, but I think the key here is the awareness about the condition and the features. What are the features of Marfan syndrome? So if you have the awareness about that, and for example, if you suspect yourself or your family member has features of Marfan syndrome, or there is a family history of aortic dissection in the family, then the individuals can bring these concerns to the GP, and based on their phenotypical features or the physical features that they have, and also their relevant family history, they can be eligible to be referred to a specialist service in the NHS, and then from there they can access genetic testing, and even if it is to reach a clinical diagnosis in the first place. So people are getting quicker diagnosis, but the awareness about Marfan syndrome and its features and the family history, relevant family history, that is key here for more and more people to get diagnosed quicker, I believe. And from our service perspective, we also make it easier for if, for example, one family member is diagnosed, and then we can help the other first-degree relatives to get predictive testing accessible, so that they will then get a genetic diagnosis, or if they are not having a genetic diagnosis, and then they don't need to be under lifelong follow-up. So it is very important to have that awareness, I believe.
Yeah.
And we can also do a service-initiated referral. For example, if a family, say an adult family member has Marfan syndrome and they are trying to access services for children and they are finding it very difficult via the GP, we can also in those instances do a service-initiated referral from our service. Okay. So then they can be directly referred to our service as well. So there are ways to help them with that.
Okay, that's really, really useful to know. Okay. Anything you wanted to add, Fortunate?
I think that's comprehensive. I think that sums it up. Yeah.
Brilliant. Okay. And so tell me about, certainly from both points of view, because obviously pediatric and adult, they're very different. But what can a parent in the first instance expect when their child is first diagnosed, Rachana? So a lot of people probably listening will have just gone through that whole process. So what can they expect in the coming months and years if their child's just been diagnosed?
Yes, that's a very important question, Joe. I think people's experiences with Marfan syndrome vary within families. So in some instances, this child getting diagnosed with Marfan syndrome, that will be the very first in the family. They don't have any other experience of people affected with Marfan syndrome in the family, and their the feelings and the emotions that they experience can vary a lot. Either way, there can be mixed emotions of feelings of anxiety, uncertainty, helplessness, and frustration, sometimes disappointment. These are common to experience. And once a diagnosis is made, from that point, a lifelong follow-up and monitoring start, ideally, for that child. And it's important for families to know why this is crucial, and also the families can expect then to have a discussion with their consultant cardiologist and along with the specialist nurse to decide then what kind of follow-up is required, the frequency of follow-up, and the type of testing that they have to do, which can include routine testing like ECG, echo, blood investigations, MRI scans to check their heart and the aorta. And they should also expect that there will be discussions around starting the child on medication, and also they can get referred to specialist services as required, for example, orthopedic or ophthalmology services. And they can also expect to have an appointment with the clinical geneticist to discuss about the genetic testing and the familial implications of the condition. And they can then also expect to get support from us, most importantly, from our specialist service, from the clinical nurse specialist and the consultant ongoing throughout their journey.
Brilliant. Okay. And do you think there's a lot of overlap with adults fortunate?
Yeah, I think the most important thing is really it's a difficult time, to get a positive diagnosis. It's an emotional experience. So I think in addition to that, we have to be there to support our patients in explaining that diagnosis, making sure that they understand. And in addition to that, offering genetic counseling, because I think we may we have a better place service to ensure that we are giving our patients the best available service to be able to access these things. And I think also it's important to know that, at the initial recipient of a diagnosis, people need time. So we need to allow people time to digest these things. And they, as parents or as adults, they can start thinking about other family members that may be affected. They can start thinking about their children, and there's also aspects of family planning. So it is quite overwhelming, and there's quite a lot to think about. And we also have to allow that, people might take this news differently. Some people might not want to act on it immediately, and we have to give people the space, the time to accept this and give them a chance to see how they want to take this diagnosis. I think as clinicians, there's always that risk of thinking, giving people the dooms and the don'ts, to say you have to act on it. But we have to be sensitive and to people's views on getting such diagnosis, and allow them to take time to digest and to direct us and to share decision making and how they want these things to be taken.
I think that's really important, the decision making, because it's always at the end of the day, we can give all the information, but it's the individual has to make those decisions, don't they? And I think often for adults, it can be more difficult because you might be established in a career, or you might be a high-flying sportsman or something, or sportswoman, and that may have implications for your condition. So it's quite hard, isn't it? If you're an adult and you suddenly have to make quite significant changes, it can take time. And I think it's really nice knowing that you guys, people like you, are around to support and have those conversations and help people with the information so that they can make their decisions. I just want to ask you. Sorry, carry on.
We talk a lot about encouraging people to extend the information to families and, casket screening. And I think we also have to be mindful that, not all families are, intertwined and talking to each other. We have to respect that as well.
Yeah.
So
definitely.
I also want to point out that Marfan Trust and your information leaflets is really, really useful for our patients, and especially when they are first diagnosed for the first time. And we do, in our service, we do signpost them to Marfan Trust to have a look at your website, and also give handouts to the families, especially the teenagers, and also the school children, the school support leaflet that Marfan Trust have devised. These are all extremely useful to help these families as well, I feel, when they are first diagnosed. So thank you very much.
Brilliant. Well, it's good to get positive feedback from you guys as well, because often you guys and other doctors and nurses are involved in working on these leaflets. So it's good to know that they're actually benefiting people. Yeah, I wanted to ask one more question, because I think some people aren't aware even that there are nurse specialists within their clinics, and I think you're an amazing resource. So can you just sum up sort of what you can offer to patients? So should they be asking about nurse specialists, or just a bit of awareness about what you can offer to them if there are nurse specialists? Because I think the NHS can be a difficult place to navigate. So it would be great to hear what people should be asking and maybe hoping to get from a nurse specialist.
Well,
I think that definitely, sorry for saying, yeah, carry on.
Okay, no, it's fine. I think first and foremost, we are specialized in that, we have taken time to understand these conditions, and we are knowledgeable in this aspect of care. So I think you're more likely to get a personalized care with from people who have some experience and expertise in this condition. So that alone should give you confidence to know that at least you're speaking to somebody that knows a bit more about the condition and has experience. So that should be a little bit more reassuring for patients, I hope.
Definitely. I think that's really important. Rachana.
I think by all means they can ask, is there a specialist nurse support available? So I know that there are many centers who don't have like eye orthopedy nurse specialists, but then there might be general, nurse specialists covering the infected cardiac conditions who also deal with eye orthopedies. It's definitely worth raising that question. Is there a specialist nurse available to support me? That will definitely be helpful, I believe.
I definitely think from my point of view, the feedback I get, and having done the role as well, I think people really appreciate the fact that often they'll see a doctor and they will get the information about their condition. So they'll find out the reassuring information about your MRI scan looks good, your echo looks good. We're going to change this tablet a little bit. We're going to see you again next year. Is there any other problems? And it can be quite medical, because that's really important. But I think seeing a nurse specialist alongside gives people a little bit more time to explore some of the other things that might be playing on their mind or that they haven't quite understood. And you have the time and the expertise to talk about some of the other things that like you were saying about schools and things like that, or problems with physical activity and some of those other things, and you're very knowledgeable about referring on to other services if you think they're needed. So I think that's definitely a benefit for people. So I think you're certainly a resource should be used, and I hope I'm not creating more work for you by saying that.
No, I think we really do advocate for the patients, because as nurses, first we are there to advocate and to make sure that our patients are getting the best level of care. And as you say, we are also the intermediary between the service. So, we will prescribe yearly intervals for patients to be seen for surveillance. But what happens in between? What happens there? So that's where we come in. So if you have questions, in between your appointments, if you're unsure about something, and if you want to, raise some red flags and, general questions, we're a perfect link for that. So I think not necessarily talking heavy on, as you say, the medical aspects of things, but the general things. And along the way, you might have questions about, what do I do? I'm thinking about starting a family. What do I do? I think a link nurse is a good for that aspect of care.
Brilliant. No, I think that's
definitely. And also the point of contact, and also to update us if the child has seen another specialist service, if there is a relevant update that they need to pass on to their consultant that could affect their management. Those are the things that the family can reach out to us, and then we are definitely that link person while they are in the community in between appointments within the hospital.
Okay.
Thanks.
Fantastic. I mean, you're doing an amazing job, and I know we get loads of positive feedback from the service at the Brompton and around the country. There's lots of really good clinics, and unfortunately there are some people that struggle and there aren't nurse specialists in their clinics, and they find it quite disjointed. So it's really good to hear about your roles, and obviously we're hoping to get more nurses like you in other clinics across the country, because I think it really benefits patients. Is there anything else that you would like to add? Any final comments?
Well,
I
I
would
think
say,
we are learning. So go on, Rachana.
no, I would say Marfan Information Day and information that we give out for these patients about making them more awareness of the condition, and the awareness that the public needs to have about what Marfan syndrome is, what are the complications, how to reach out help. These are the key factors that can help us in reducing the morbidity and help these patients to improve the quality of life by accessing the specialist care that they are eligible for. So sorry for today.
Yes, I would say in addition to that, I would say we are also learning and we really value your feedback as patients to see how we can do our job better. I mean, you know, we have the tools to tell you what we think should be happening, but you know, there's no better feedback than you know, from patients, and that can direct us to do a better job, to do our job better. I think, you know, the role needs more awareness. We need more of clinical nurse specialists doing this job. Because I think there's a lot of patients and families that need our support, and together I think we are able to improve patient outcomes and satisfaction with the services that we provide across the country.
Brilliant. Thank you so much for joining us. And yeah, thank you for joining us during Marfan Awareness Month. I think you know, I just want to echo what you've said. I think you're an amazing resource. I think raising awareness obviously is our key goal as the Marfan Trust, and that's what we're trying to do during this month. Excuse me. So thank you for helping us with that, and we look forward to continuing to work with you in the future. Thanks very much.
Thank you for having us.
Thank you very much.
Thank you so much.